one chance. One place. Discovery Health Channel. Real life, medicine, miracles.
Matthew! Matthew!
This is extremely serious.
Reno, Nevada usually brings to mind drinking, gambling, and prostitution. But Reno is so much more. This majestic city has a small-town spirit where people help neighbors in need.
We all work together for a common goal, and that is to help the community no matter what the problem is.
Hi, Tyler.
Most of what we do is social work. Any paramedic who's been in the field for at least a year or so gets very good at it, whether they know it or not.
Okay, I need you to give me a thumbs up, okay? The calls that I find most gratifying are not necessarily the medicals or the traumas, but it's the individual that you talk to. It's not giving drugs, starting an IV, but it's treatment all the same.
Let's give you a little oxygen here, dear.
Anytime a patient is very critical and walks out of the hospital, that makes it all worth it.
My name's Russell Barnum. I've been a paramedic for about 2 years now. Hey guys, how's it going? The thing I like most about it is the fact that you're not behind a desk. You're out roaming around the city. You're kind of the captain of your own ship. Come here, sweetheart. I think I'm stronger in talking to a patient and trying to figure out what's going on. I let them tell me a story, and from that story I pick and choose what I need to focus on. I do my assessments more by conversation than I do by interrogation. How you feeling? You are automatic.
Paramedics, what's the problem there?
He said he has chest pain.
He has chest pain?
It's 8 hours into Russ's shift. He's dispatched to downtown Reno for a chest pain call.
We got called to one of our local hotel motels, rent by the week kind of things, for chest pain, which typically amount to little. This is when you get caught with your pants down. And we got there and there was this gentleman laying on the floor in obvious distress. Oh, how old are you, Paul?
I'll be 71 May night.
Yeah, what's bothering you today?
Chest pain.
Chest pain? Ever felt this way before?
Oh, yes, yes.
On a scale of 1 to 10?
9.5.
9.5? Sir, can you take a deep breath for me? Medical calls are the ones that are really challenging. Are you short of breath, sir? You are? That's when you have to do detective work. That's when your assessment skills come into play. That's when you need to try to lead your patient into telling you what you need to know. Does that pain in your chest get worse when you take a deep breath?
Yeah.
Do you feel your heart racing?
Yeah, well, I just feel the pain more than...
Have you ever been told you have supraventricular tachycardia? Supraventricular tachycardia is when the heart is beating above 150 times a minute. When it's beating so fast, it doesn't have time to fill up, and so you get a drop in blood pressure. The coronary arteries can't fill as well, so that causes chest pain.
Paul's condition requires a drastic measure.
Real still. Hey, sir, I know, but it's important you hold real still so I don't have to do it again, okay? Relax your hand. Relax your hand. There you go.
Russ needs to give Paul adenosine, a drug that stops the heart in order to reset it. The effect of this drug is extreme, but necessary. If Paul's heart rate is not slowed down, he could die.
Yes, sir.
All right, here it comes. Yep.
Imagine being told that your child has has only 5 hours to live, or losing every skin cell on your body. Imagine pouring maggots into your wound in order to survive. Now, in this incredible new series, witness the most rare and extreme medical conditions.
There wasn't anywhere to go to get away from the pain.
Extraordinary stories and amazing medical discoveries.
It was just a beautiful miracle to live.
Medical Incredible premieres Monday at 10 on Discovery Health Channel.
Paramedic Russ Barnum just stopped Paul Adams' heart with adenosine in hopes of kick-starting it back to a normal rhythm.
There we go. Good. It's a drug that, when we get to use it, has a profound effect. You can really fix the problem. It's pretty gratifying. We got the pain gone? Good. Excellent. Okay.
I'm staying here and going to the hospital.
What?
Nope.
Oh, you gotta go to the hospital?
Nope.
Listen, Paul.
Nope.
Paul, listen to me, okay? I know it happens all the time, but you can die. Okay?
I'm 71, come on.
Yeah, it does matter. It matters to me. We gotta take you into the hospital so they can do something about this. Paul, don't fight with me, Paul. You've been through this how many times now? 3 times. You know, the outcome is always the same. I know, sir. I know. You see what I got here?
What's that?
That's another dose of the stuff I just gave you, because I've given this enough times to know that that can come back at any time.
I know.
So I drew up 2 doses.
I know.
Pretty safe, Paul.
Okay.
All right. That boy. That's what I like to hear.
I like it.
You all right? He was pretty ornery to begin with. We gave him the adenosine. His chest pain went away. He was becoming a little more cooperative. I'm sorry I had to give you the hard sell. I'm sorry. I wouldn't be doing my job if I didn't. Okay? Have the doctors talked to you about fixing this? Come on, Paul. Have they?
Fixing what?
Well, it's a real easy fix.
Yeah, I heard about that too.
Yeah?
Right now.
You don't think so?
No.
We got to keep coming by and bugging you then. Keep giving you that shot.
Well, good, then we'll get a cleaner, won't we?
Yeah, we will. All right, we're going to get you moved over and be in the hospital on the jump.
And just one lady doctor, we don't get along, so.
Oh, really? Well, there's no lady doctors in here tonight.
Yeah, thank God.
I think I know the one you're talking about. At the end, we had a pretty good rapport. You start out enemies, and at the end, yeah, he decides that you're an okay guy.
One big scoop, one more. There you go, very good.
Paul's 70. Apparently has a history of SVT. He's been told the possible ways you can fix it. He decides not to. This time he converted with 6. Pressure popped up, chest pain went away. Right now he says he feels fine, wants to go home. I told him he might possibly die, but he said there's no way he was going to die until the Lakers won the NBA title.
You feel like a new man.
There's a lot of different ways that you can fix the problem. They can do ablation therapy and burn out the center that's causing the accelerated heart rate. They can put in internal pacemakers. They can do all kinds of other things. But a cardiologist would know better than me. I'm just a paramedic.
Paul, are you taking off?
Yeah. You know, once I get that it stops, I feel much better.
Oh, okay.
I just walk right down Mill Street. Well, I might wait for the bus, but I don't know how often. But you know, one day it might catch up with me. I hope it just takes me away without the pain. I don't care. But I thank God for the emergency trauma people. Take care, guys.
Tomorrow, a teenage ballet dancer loses control of her car. A high school senior crashes into a tree. Each young victim depends on Baltimore Shock Trauma Unit to survive. The Critical Hour, tomorrow on Discovery Health Channel.
Come on, buddy.
In his spare time, paramedic Russ Barnum works ski patrol on a mountain south of Reno.
I moved up here from Tucson, Arizona after I got done with college. Decided I wanted to learn how to ski, so I got a job as a lift operator. After skiing for 2 years, I decided to become ski patrol because they actually get to ski on the job. So I had to get my EMT for that, and I found out that I really enjoyed the medical aspect of it. Then I got my EMT intermediate, and then I got my paramedic. And this was kind of the start of it. Stay, leave it. To tell you the truth, I get most of my experience with orthopedic injuries on the mountain. I see more fractures up here in a day than I can see down in town working on the ambulance in a month.
Russ heads down the mountain to begin his evening shift on the ambulance. His first call is dispatched as a psychiatric problem.
10 should be second building on the left. Should be this one here.
All right, paramedics?
Yep.
Nyla O'Brien's neighbor has called 911 for her several times in the last few weeks.
Let's go inside. Okay, we'll have a seat. We'll talk about it.
I called him yesterday.
You know what city you're in, Nyla?
Okay, right there's Reno.
Reno? I know, they seem like silly questions, but we have to ask everybody. Okay, I know. We have to ask everybody. Do you know what year it is?
It's 2000.
And who's the president?
Clinton.
Mr. or Mrs.?
Should be Mrs.
Okay. So you have control of all your faculties. We know that much. Okay. So what's going on today?
I told her I called you guys because I failed to stay with her yesterday.
Well, my fiance, she's got her master's in sociology, and I always tell her, you need to come along with us because we do a lot more social work than we do medical or we do trauma. You know what, Nyla? My partner Ben's going to stay with you. He's going to take some vital signs, and I'm going to go outside and talk to your neighbor, okay? Why are you concerned?
Because the first time she fell and broke her leg in the bathroom.
Today?
No, months ago.
What about today? What's going on today? Why are you concerned?
No, it was yesterday.
Yesterday. So did she fall yesterday?
No, she fell 2 days before yesterday.
Specifically, what happened yesterday that called you to call 911? Not only are you treating the patient, you're treating the scene. There were actually two patients there, her friend and Nyla. And you have to find out, is there a medical problem?
We're gonna put you on our heart monitor, okay? A couple cool little patches.
Russ's partner Ben checks Nyla's vitals. Although she's been falling a lot recently, she is stable now.
Nyla, you have a really concerned friend out there.
I know.
Have you been falling a lot lately?
Yeah.
More than usual?
I find myself getting a little woozy.
Don't you think you should get that checked out? She just had an extensive medical history. She didn't like hospitals, and in this case, she's not going to be the type of person who's going to go to the hospital unless she feels there's really a problem. There's not going to be any skin off your back except a little bit of time.
Russ, I don't want to go tonight. I've practically lived in hospitals since he was a little boy.
I know. I understand. But the falling down is something new for you. Will you let us take you?
I will wait till tomorrow.
She refuses. She wants to go down tomorrow.
Please, Nyla, please.
Nyla, do you need anything else from us?
No.
Okay, bye-bye, dear. If you need to call us back, you feel free to, okay? Just call 911. We'll come right back, all right?
Take care. All right?
She's just done with being in hospitals, and we see that a lot, especially with the older population. And as long as they can make their own decisions, there's nothing we can do about it.
Next, on another episode of Paramedics, long hours, sleepless nights, and adrenaline-filled rescues. Experience the chaos of medicine in the streets. Next on Discovery Health Channel. Real life, medicine, miracle.